really, I really experienced, Dodge County used to have two separate facilities, psych and regular Clearview nursing home with a ton of orthopedics.
I see it's 5 o'clock. According to my calculations here. Can't even tell if I'm speaking on mic or not.
Yep.
Oh, okay. All this new technology here. I'd like to call the Health and Human Services Board together here at September 18th in room 1400 of the Government Center. Roll call, please.
Sean Anderson,
Present.
Mike Barkalow,
Present.
Kathleen Findley, Kathy Leaf is excused, Lisa Lind,
Present.
Deb Lindeman,
Present.
Dave Osnes, Julie Smith,
Present.
Greg Chalajon.
Present. One thing in this new technology, if we have more than 4 mics on, the first person who had a mic on will be muted. So if we're taking a vote tonight, we'll not use the mics. We'll just do a voice vote loudly. So
it's rotating. So only 3 mics can be on at a time. So when the 4th mic goes on, whoever was first in the sequence goes off. So unless that's the person you want to shut off,
I'll hold up 3 fingers if we want to cut
that's
somebody
you know, elected official strategery 201. That's up to you guys.
off. Approval of the minutes. The minutes were in the packet. If there's no changes or corrections, the minutes will stand approved as presented. Is there any changes? Hearing none, the minutes are approved as presented. Public comment. I have one here for Celeste Colborough.
Very good. Thank you. Very good. My name is Celeste Cobrell. I live in the town of Hudson. I'm in District 4, Kathy Leaf's district. I did send in a written public comment, emailed it earlier this afternoon. I have some other copies if anybody wants to see one now. But in a nutshell, I'm urging you to limit the rate increase for the skilled nursing facility, the per day rate, to no more than 5%. And I ask you to do that because it's much more in line with the rate increases that have been taking place for skilled nursing facilities across Wisconsin. They've averaged about 3%. I know the proposal is for 10%. That's a really big bump in 1 year. And it will have a very big impact on the people who are still private payers. One of the things that we can do with our county-owned healthcare campus is we can consider the common good and how we serve everybody in our community by keeping our rates relatively more affordable. It's still very expensive, even at a 5% increase. That would bump the rates up to $336 per day. That makes the monthly charge go up to $10,080, and it makes the annual cost $122,640, which is a lot of money. When we raise the rates, the effect is basically to drive our elders into qualifying for Medicaid, which means being impoverished at a faster rate. And I want you to think about how does that really help the communities in our county and the families of our elders. Please hold the increase to no more than 5%. Thank you.
Thank you. Is there any other public comment? Any other public comment? Any other public comment? Hearing none, thank you. Business item, financial report for August 2024.
Good evening. Okay, can you hear me? Okay. So the financials through August of 2024 are included in the packet. Just a couple of things to go over. So if we scroll to, well, the page numbers aren't on here on my copy, on behavioral health, if we scroll down to there, I was just going to talk a little bit, mental health revenues. We were kind of Looking through those, line item 46640, they're a little under where they were last year, but in line kind of with what we had budgeted. We do have some additional money coming in. You know, those are behind because of the collections, not quite at the same percent that our tax levy is at. Also with our purchase services, those are looking better than they were at the same time last year. But we did just have a lot that we paid out this past month. So a lot of adult protection invoices came through. So we will see those jump up next month, probably to be similar to where they were last year at this time. Other than that, we've talked many times on children's services. So if we scroll right there, if we look at our purchase services, we are now showing over our budgeted amount. And we've talked that those are specific to some high-cost placements and to our birth to 3, where we've had increased contracted services just because of the number of kids that are enrolled within that program. Then, if there's any questions on human services, otherwise we'll go to the healthcare campus. So if we look down at our healthcare campus, and we'll go all the way to the 3rd page of the 4,200, one more. So we are still showing a positive balance in the healthcare campus. Our census is as high as it's been in multiple years right now, so we are continuing to take admissions. We are taking longer term admissions in addition to the short term ones that we have for our Medicare. And then with the depreciation in here, we're still showing the positive balance of $605,000. So we're doing well right now. Any questions on the financials? Okay, that's all I've got for you.
Thank you. Next item, business item, is consideration of the 2025 proposed rate increases for the St. Croix County Healthcare Campus. Who is taking that?
Mr. Chair, we need to make a slight correction on the agenda item. It says in your packet that the 2023 rate was $320. That should read the 2024 rate currently is $320 a day. The 2023 rate was $310.
Is there any discussion on this, or we need a motion on this, correct? Go ahead, Mike.
Motion to change, so that it reads 2024 rate at 320, 2023 rate at 310, right, Bob?
Yeah, you don't need a motion to correct that. The year we can correct. As long as the dollar amounts are correct, we'll just make a notation that that amount is correct.
Okay.
Well, we need a motion to.
You need a motion to change the rates, though. Yes,
Rates.
you do need that.
Is there a motion?
Motion to change the rates.
You'll change the rates?
I'll second that.
Sean will second it. Any discussion on the rates?
I can give you a little update. I've done a survey of the area St. Croix County facilities, and the rates range from the lowest of $335 to the highest of $430. And we're most people are at the $350, $360 rate right now, including our facility within New Richmond is at $350 right now. So the 352 is right in line with the other facilities in the area.
Any other questions or discussion on the rates? Go ahead.
The question I have is, when we say, change the rates, I don't understand what you're trying to change, to move to the 3% or 5%?
I thought we were trying to correct the error in the statement of the 2023 rate being
Okay.
320 when it was 310.
No, so the motion was to change the rates from $320, which they currently are, to $352, which represents a 10% increase.
Right,
Yep.
okay,
That's what the motion on the table is.
okay.
Any other questions or any further discussion? Hearing none, everybody in favor, say aye without the mic. Opposed, say nay. Motion passes.
Kitty Rhodes, the Dementia Crisis Stabilization Unit was originally in 2020, $425 a day. And I checked with the other facility, facility in the state of Wisconsin, and $650 is in line with that facility per day.
Is this two separate motions then?
Yeah, I guess you'll have
Yeah.
to clarify whether, because the motion had been to change the rates.
Yeah.
So I guess I don't know whether you were looking at just the one rate or if you're looking at both.
I
If you want to be
I was
clear,
confu-
you can do the second block as another
I was-
motion.
I was confused too, so.
Yeah.
So. well,
Does the membership think they changed all of them or just the skilled nursing
I
facility?
think everybody's assuming we changed the health center skilled nursing facility rate
Okay.
now.
Yep,
So
you can do a second motion then on the
we'll
other.
need a second motion for the Kitty Rose Memorial Memory Care Center rates. Is that correct? Is there a motion?
I move to accept the Katy Roads at $650 per day as written.
I'll second.
Yeah, I just want to clarify, this is kind of following up on the grants we've received to kind of do the I guess, shorter term crisis stabilization, correct? That's what this is for, okay. I just wanted to verify that, no, I'm good.
Any other questions or discussion? Hearing none, all in favor, vote by saying aye.
Aye.
Opposed, say nay. Motion passes. Next item, Wisconsin Counties Association is asked to have a resolution passed requesting that the state of Wisconsin to provide funding for community support programs and crisis services for counties in the 2025-2027 state budget. Bob Rohart is going to give us more details on that.
Yeah, thank you, Mr. Chair. As you stated, the Wisconsin Counties Association is asking human service boards across the state to support this resolution that would increase the state's portion of funding to county governments for crisis services and the community support services that provide care for anyone in crisis or people with serious and persistent mental illness. Currently, the state share is covered by counties, and there's very little in the way of funding for uncompensated care. So the WCA is lobbying on our behalf at the legislature in the next session to increase the state's portion of funding and make counties, and to assist counties who are currently on the hook for a lot of these costs.
Too many buttons in front of me. Where's Kathy when I need her? Is there any discussion or on this, or let's have a motion first to pass it?
I'll make the motion to approve the resolution.
Is there a second?
Second.
Any discussion on this resolution or any other questions? I want to scroll it up and I can't scroll it up. Oh, go ahead, Deb.
Is there a certain amount that you're asking for, or what? I mean, right now, they don't pay anything, and then, so what are we, what's the counties association asking for? Anything specific, like a certain amount, or?
The association is looking for the state to cover the state share of Medicaid funding, which currently counties cover.
Have they
And-
ever covered it? Has the state ever covered?
Well, in my time here, no.
Okay.
There may have been a time in the past where they did, but,
Why the
and
change?
the other ask of this is the uncompensated care that counties are responsible for, and state aid funding for crisis services isn't sufficient to cover really much of that, so. Does that help?
Yeah, I was just curious about that. Thanks.
Any other questions, comments? Hearing none, all in favor say aye. Aye. Opposed, say nay. This resolution passes. Next item, resolution urging the Wisconsin State Legislature to reform the funding model for the out-of-home child placements. Bob, are you going to take that again?
Yeah, I can summarize this, and if there's additional questions, Michelle Lesha is here from our she's our Children's Services Administrator, who could probably answer more specifics. But the resolution is again directed at the state to assist with funding for children in out-of-home placement, especially in residential care centers. The cost of some of these facilities can be as high as $500,000 a year, and some of these kids that need that level of care, first of all, if we can find a place like that that will accept these children in our state, the cost is excessive and there's no state contribution towards those costs. It falls on the county to pay for those placements. And sometimes they're out-of-state placements because there aren't sufficient, there isn't a capacity within the state to serve these kids with severe kinds of disorders or trauma, kids with lots of severe trauma and other conditions that require their placement there. So what this resolution seeks to do is seek support for state funding that would be more in line with what the state does with adults right now who do qualify for reimbursement through Medicaid or from the state. Children don't get that. We don't get that reimbursement. So the cost falls primarily on the tax levy, as Faye pointed out, our purchase service costs that you see going over budget. The other ask here is, I think, for the state to be more helpful with the logistics of finding placements when there's a need for a high-intensity level of care for a child. And I'm going to wait just a second. There we go. Right now, the state hasn't particularly been helpful in the logistics of finding placement for children, and our Children's Services Division really has to scramble on sometimes very short time frames to find a placement somewhere in the state or even outside of the state. And I think the resolution is asking that the legislature look at how the state of Wisconsin can be more helpful in finding placements and covering the costs of them, because it's really the primary driver of a lot of our tax levy dollars going to these purchase service costs. And if there are specific questions around that, again, Michelle is here. She can help answer those.
If I could interject one thing, maybe a question Bob can answer, one of his staff. There was a time when counties used to cover the adult cost, and then the state picked that up. I don't know, it was 15 to 20 years ago, somewhere in that time frame. So it used to be that counties were burdened with the cost of adult placements, and the state came in and says, you know, it's getting kind of expensive for counties. The state will pay for those. But they haven't done that for children yet, but our costs for out-of-home child placements has gone from $1 million a year to $2 million a year in the last 3 years. So that's an extra $1 million of taxpayer funds that are going out for something that we have no control over.
Any other comments on it? Yeah, we need a motion to approve this resolution. Mike,
Motion to approve?
Second? Dave? Any other discussion on this motion? All in favor, say aye. Opposed, nay. Motion passes. Thank you. Review of 2025 budget requests.
I've been asked to present the budget in the form of interpretive dance. I haven't fully prepared that yet, so you're not going to get it this evening, maybe at the committee of the whole if I have enough
Tap
time.
dancing, huh?
So we are going to look, though, at the requested budgets in an old traditional format with numbers. When all of the departments have submitted their budgets and I add everything up, they had $3 million in additional requests for tax levy dollars. So I look at where our revenue sources are for tax levy, and we had 2.03% net new construction, which is worth $664,000. We had a referendum approved for 7.5 positions, which are in this total request, for $896,000. So I have about $1.5 million of tax dollars available. The requests then are over that by about $1.5 million. So I have nearly the $1.6 million that has to be cut from the budget. So we're going to go through what's requested. I've already been working with the department heads. The finance director and I have sat down with all of them. We're picking apart the budgets, finding those cuts, and at the October 1st Committee of the Whole, I will present to you a balanced budget, but it will include $1.6 million reduction from the request that you're seeing here. So to set the frame. So your role or goal tonight, I guess, is as I go through this, if there's something that I talk about that you say, that's absolutely important, make sure you don't cut that, or, you know, we don't really support that idea or that program, you should look at cutting that. That's what I'm looking for, is any last minute feedback before we finalize the budget. All right, so as we read the budgets, I'll go through how we look at them, and then we'll go through them faster as we go. So this last column on the right is the requested budget, the 2025 requested budget. The column back is where the budget or actual year-to-dates were as of August 6th, the day that I printed the report. The middle column then of numbers is the 2024 adopted budget, so that's really where we're comparing to. And then the 2 prior year actual cost. The first thing I do when I look at the budget is I look at the very first row. That's the general property taxes. So that general property tax number has the biggest impact. And that's where our biggest restriction is. So I look to see where that changes. So this is all of Health and Human Services combined. So they went from 8.3 million to 10.2 million, so a $1.9 million increase. So there's a lot there. And Health and Human Services makes up 30% of the county's budget. So we would expect to see some increases. So the next line I look at, I sort of skip through the rest of the revenues. I go all the way down to the net wages and fringes, the center of the page there. And I look to see how much of an increase that is, because that's going to explain a lot of it. So we went from 18.4 million to 19 million. So there's almost $800,000 increase in wages and fringes. So within that, we have some new positions. I'll detail those more as we go through maybe the departments. We do also have a step increase that's built into that. So that's about a 2 to 2.5% increase for the employees. And we have a health insurance increase reflected, which is a 10% increase. So health insurance is up by quite a bit. So that's impacting the budget on the fringe side dramatically. So some of that increase we would expect to see because of the wage and benefit increases. The next thing that I look at then, after I look at that, there's still some unaccounted for change in the general property taxes, is I come down to almost the bottom. I look at this operating supplies or operating costs. So this is all of the non-employee costs that we have. This is really something that the department heads usually have a lot more control over. You can see there, that's up $700,000. So between the two, that's going to make up the entire $1.9 million that we have. I'm going to scroll back up because Health and Human Services is special in that they have this purchase services line. So this purchase service is $7 million. It went up from $6.5 million. So there's $800,000 increase. That's part of that operating, which was up by 700. But this is 800,000. So really, the rest of the operating expenses were down by $100,000. This $800,000 increase, almost all of it, really is primarily in the children's services, out-of-home child placement cost. And if you look at, and we'll see it when we look at children's services, but if you look at last year's actual, we spent $8.7 million. We had budgeted $6.5. So they're $2.2 million over budget on that purchase services. That's the resolution that you just passed. That's what we're addressing. They were at $4 million already through the year, August 6th. Their request for $7.3 million is probably light. They probably need more than that, but they realize they're not going to get it, and they're not going to get it. I don't have enough money in the county to fully fund where that is. So we'll talk about probably more at the October 1st meeting, what some of the ramifications are, what some of our options are. But just know that I can't absorb $1 million increase in out-of-home child placements. That's just not a sustainable model for the county. All right, so that's Health and Human Services as a total fund. So we look at each of the individual departments then. So when we look at public health, they went from $840,000 in tax levy up to $1,038,000. Public health really, one of the things is they're having decreasing revenues in some of the other areas, which were offsetting some of their normal expenses. If we look back at some of their earlier years pre-COVID, their tax levy was actually probably closer to this million. You know, if you adjust for inflation, they're probably on track to where they were. They were just able to reduce some of their costs, save the county some money over the last few years. That's coming back, though, as some of those grant opportunities have ended. Because if you look at their net wages and fringe, it's up about $100,000, going from 1.9 million to 2 million. That's just the staff that they have and fringe costs that are affecting that. If you look at their operating costs, it's up $2,000. So really, it was on the mostly on the revenue side, the wage and fringe that you're seeing, but also some reduced revenues. So if you have questions along the way, just stop me. All right, so when we get to behavioral health, they went from 1.9 million up to 2.3 million, so almost 400,000, 350 to $400,000. So one of the things we want to look at is we want to look at their net wages and fringe. So they're at 3.5 and they're still at 3.5. So the behavioral health staff are getting a step increase. It's not that we're not giving them that. They are getting the health insurance change. What they've done without is a lot of the ARPA positions have come out of that. And so you've seen those positions go away. So there are other wage and benefit increases. It's just being offset by a reduction of ARPA staff that will no longer be with the county in 2025. And we also have some reduced revenues that are offsetting that. If we look at their operating expenses, those are actually down about $100,000. So their wages and benefits didn't go up. Their operating expenses went down, but the tax levy went up. So really what it is reduced revenues. A lot of that is the federal payments, that second row that you see. Those are the ARPA dollars, so that reduced. But some of the other ones must be down a little bit also. Or not too much, but. So that's what's going on with behavioral health. CCS, nothing to see here. We'll just keep moving on. No, really the CCS program is a fully funded program. They have zero general property tax dollars. All of their costs are billed back to the state. I think it's one of the few programs that we have where we get 100% reimbursement. So really there isn't much to see here because it's not going to affect the property tax levy at all. Their wages and fringes are up slightly, and their operating costs are down slightly. All right, economic support. So they went from $149,000 to $178,000 in general property taxes, a small increase there. If you look at their net wage and fringe, up about $32,000. That's just the standard increases that we're going to see throughout the budget. Their operating expenses are down about $500, $600. So not a lot going on. Children's services. All right, this one. So they went from 3.5 million to 4.5 million. So that's enough to catch my attention. When we look at that, we're going to look at their net wages and fringes. They went from 4.4 million to 4.7 million. There is an additional position in there. It's going to be a grant-funded position. If we don't receive the grant, they won't receive the position. That's the right one, right? That's in behavioral. Oh, never mind. It was over in Shar's budget. Then we have a position in children's services.
There was a position that was funded through the referendum.
That's right.
That was transferred.
All right. So I'd missed one in behavioral health. There's a position there that's grant funded though. Okay, so in children's services, we approved 7.5 positions through the referendum. One of those positions was a youth justice caseworker, something along those lines. And it was going to be in justice support services. That was our original plan. The department sort of talked about it though, both children's services and justice support, and they mutually agreed that it would probably be better placed in the children's services division. Justice support services doesn't work with any youth currently. They only work with adults. The children's services division has very similar types of positions, and so it would be a better blend to put that position here. So we changed where that position reports to, but that was the position that was authorized through the referendum. So some of the increase in here is that additional position that you're seeing in there that was authorized by the taxpayers. The big change then is going to be that purchase services. So this is, in large part, it's not all, but in large part, it's that out-of-home child placements. It's making up about $2 million of what our expenditure was last year, and you can see the $800,000+ increase. It's related to out-of-home child placements. So that's what's making up the majority of their total operating expense increases. All right, the ADRC. So we see them going from 374 to 605,000, so they have a bit of an increase there. When we look at their net wages and fringe, they went from 1.8 to 2.1. There's 2 new positions that the ADRC has requested. They're about 50% grant funded. We'll be able to recoup some of the money from the state for both of those positions, but we'll end up picking up half of those costs. So half of the costs are offset, half of them are being paid for by general property taxes. If we look at their operating cost, they actually dropped by about $17,000. Any questions on those positions or anything else there? All right. Health and Human Services Administration, they're up by a little under $100,000. If we look at their net wages and fringes, it's up about $60,000, and their operating is up about $50,000, and that was mostly a reduction of their overhead, what they charge back to the other departments. There was some change on that. Well, you remember what that change was on the overhead, why you made that? Faye wants to jump in here.
We use it to offset CCS so that gets zeroed out, and we needed less overhead put in CCS to zero it out.
All right.
So it's just
we saw some of the reductions that we saw in CCS, their operating expenses and stuff went down, so the fix there was a smaller amount. All right, on to the healthcare campus then. So the healthcare campus, this is a snapshot. The 4,200 is a snapshot of all 3 divisions, and then we break down each division separately. I'll probably just go over the healthcare campus as a whole, as a single unit instead of the individual divisions. I don't know that individually they make much of a difference once you understand the big picture. The big picture, though, is Medicaid rates are higher. So 2022 and 2023, you could see that the institutional care costs were about $6 million, $7 million. We had planned on about 4 for the year, or 8 for the year. We're already at 4, and that is jumping up to $12 million for 2025. So the 2 big changes there are that the Medicaid rate is higher, And two is that we're going to be opening Kitty Roads, so we plan on additional revenues for that. So with those additional revenues, we see a negative fund balance applied. So a negative fund balance applied is a good thing. That's the amount that we project is really the operating profit of the business unit. So last year we had projected about $300,000. This year we're projecting about $1.9 million. Now the requested budget was before the committee of the whole when we discussed the nursing home. So this does not include the requested or recommended $500,000 contribution to debt service. So that would come out of this. There was also some additional discussion about additional chargebacks to the healthcare campus for HR or IT. We already do quite a bit for finance and facilities and the benefits coordinator position. But some of the other ones we probably hadn't scrutinized as closely. And considering the large business unit operating profit that they're looking at, we've taken a closer look at those too. So those are additional changes that you're going to see in the recommended budget compared to what you're seeing right now in the requested budget. So that number will come down quite a bit as we're using some of those resources elsewhere. If you look at the net wages and fringes then, at the bottom of the page, we'd been averaging about $4 to $4.5 million per year. We're projecting almost $7.5 million for 2025. And again, that's additional staffing for Kitty Roads along with wage and benefit increases that you would normally see. And then all of the operational cost. Again, you see the operating costs going up by $500,000. That's because of the additional wing being opened up. Any questions on the healthcare campus financials? Jump down then. Veteran Services, that's another division that you guys have reporting to you. So their property taxes went from $315,000 to $331,000, so $16,000 increase. If we look at the net wages and fringes, they're up about $18,000. So there's where the increase is. And then you're going to see their operating was almost identical to what it was last year. So that is it for requested budgets. Any questions on any of it?
Was it back at CCS where you said we couldn't afford to fund any higher? How do we pay for those services then if we can't?
Yep. So I cannot raise taxes enough to cover that.
Right.
Nor would you probably want to. So my recommendation in the recommended budget, the way I'm going to do it is I'm going to cut $500,000 off of their request. They had asked for $800,000. I'm going to cut about $450,000 off of that request. So they're going to be shorted. Two reasons for that. One is they have a healthy enough fund balance that they can survive a couple of years doing that. So we're going to burn through their cash. So that's going to create a problem in a few years if the issue is not resolved. One of the things that I know, though, is that we have a youth on there, our highest cost one, that's running about $480,000 a year that will age out in 2 years. So when that one ages out, if that drops off and isn't replaced by somebody new coming on at that cost, the purchase service cost will actually fall back to where my budget is. So what I'm planning is that it's an anomaly and not a trend. We're going to use cash for 2 years and then hopefully get back there. And if not, hopefully by that time we've had some impact on the state legislature and they've looked at this and realized that they should probably start picking up this cost since it's all ordered by the courts. So the state employees are telling us that we have to pay for it. So the county taxpayers pay for it, but we have no say over it. So I think there's a long-term fix and there's a short-term solution. So that's my plan.
Any other questions or comments about the budget? No other suggestion? Do we need to approve this, or,
Nope, there's no approval required for this. This is your first chance to take a look at it.
right?
So from here, you'll see within the next few days probably, the county administrator recommended budget come out in digital format, and your paper books will be available so you can start going through those. We'll review those then in detail, really the same format through all the budgets at the October 1st Committee of the Whole meeting. You have a month to think about it, and then you'll be able to take action after the public hearing on November 6th. That's a Wednesday. We're moving the county board meeting, remember.
Thank you.
Yep.
There are no other business items, requests for future agenda items. Any requests this time? Hearing none. Any announcements? Mr. Rohart.
Thank you, Mr. Chair. I had two announcements for you. Our Public Health Division was recently reviewed by the state. It's called a 140 review to make sure that they're meeting all of their requirements to be a level 3 health department. And they received, I think today, was it? Yeah, today, notification that we were recertified as a level 3 public health department, which is great. Credit to Ellie and her team on that. And then the other announcement was around an aging plan public meeting for the ADRC. They have to put out an aging plan every 3 years. And this is a meeting that will occur at the Services Center on September 25th at 1 o'clock. It's an opportunity for the public to provide input on the aging plan that the ADRC put together. So September 25th at 1 o'clock at the Services Center for public input. That's all I had.
Any other announcements from any board member? No? Date of the next meeting will be October 16th, and we are adjourned.